With healthcare reforms here, advocating for the pharmacy profession is more critical than ever. One way the USC Pharmacy School is doing this is by utilizing research conducted at the USC Leonard D. Schaefer Center for Health Policy and Economics.
Pharmacists have an important role to play in the healthcare system, but they have to demonstrate it. And the challenge right now is to show that they can provide value. And I think pharmacists actually can play a really important role in delivering chronic care and helping patients in ways that will substitute for really expensive and scarce physician time.
Many of our pharmacy students will start their careers as pharmacists behind the counter, but at some point in their careers they're going to be in a management position, and they're going to be in a position where they're going to start having to make decisions about formularies and about which drugs will be funded under different benefit management plans. And so the training they get at USC can help them better prepare for those job responsibilities later in their career.
Probably the most important thing to take away from working in health policy and working with economists and psychologists is that pharmacists can provide a very, very unique perspective that other clinicians don't have. We are the medication experts. We tend to look at patients and treatments very differently than how a physician handles it.
This isn't a turf issue about pharmacists versus physicians. This is about working on a team, working together to make the patient better.
Results of interprofessional care can be found in the Patient Safety and Clinical Pharmacy Services Collaborative, where physicians rely on pharmacists to manage high-risk, high-cost, complex patients.
We started with 68 safety net organizations back in 2008, I think it was. Now we have 160 in the collaborative, which doesn't sound like a huge leap, except now we're partnering with the Center for Medicare and Medicaid Services, and they've greatly expanded the number of entities that will have to implement clinical pharmacy services. So it really is, I believe, the most powerful force right now in this country, pushing for the promotion of clinical pharmacy services and trying to make sure that clinical pharmacists are an essential part of the healthcare team, which they need to be.
I was very excited when I saw them hands-on and visiting patients and prescribing, explaining, and making patients more comfortable with the medicines that they were receiving. And so I witnessed this firsthand, and I was very impressed, and impressed enough to suggest that we ought to be doing this elsewhere, and I'm anxious to see that take place.
Getting the word out about the value of pharmacist patient-centered care is also key.
Our dean he's had articles in well-known magazines like the Wall Street Journal, as well as Politico, as well as spending a tremendous amount of time helping educate elected officials.
You know, our school is really committed to advocacy. We think it's important that our students are exposed to these kinds of issues, because it's really going to be advocacy, interaction with policymakers, doing the right kinds of research. It's really going to form what healthcare looks like in the future.